Yes, coming in.
Hello, I'm Stephanie. I'm a student nurse at South Florida State College. I'll be helping in your care today.
Okay,
Prior to coming in, I did sanitize all my equipment so it is clean.
okay,
I checked your door to make sure there are no isolation signs, any fall precautions. I also checked your chart for your baseline to make sure I knew what your baseline vitals were before we started.
well, thank you.
First thing I do when I enter the room is I'm going to assess it, make sure there's no trash, make sure there's no clutter, anything that can make you fall.
I appreciate that.
Again, I am Stephanie. I'm going to be helping in your care today. I'm a student nurse. I'm going to write my name on the board. I'm going to place all my equipment down on my sanitary barrier. Alright, now I'm going to wash my hands so that way they're clean. Whichever. Wash my hands, put some fresh gloves on. And notice your bed is not in the lowest position. I'm going to go ahead and lower that bed.
Why, thank you.
I do notice that your front side rails are up. Is it okay if I bump your bed to make sure that it is locked?
Sure.
Alright. Can I get your first name, your last name, and your date of birth?
My name is Lori Carls. My birthday is May 14th, and that's all you're getting.
Okay, can you tell me where you are today, ma'am?
I'm at South Florida State College. Not really sure why I'm in the college instead of the hospital, but
Because we're going to take very good care of you. Can you tell me what year it is, ma'am?
2021.
Do you have any allergies I need to know about?
Yes,
Which are?
codeine.
What is your, what reaction do you have when you take codeine?
Oh, I get delirious. I itch. I get a rash.
Okay, I'll keep that in mind and make sure that nothing we use today will have codeine in it.
Good.
How about any allergies to latex?
No,
Iodine, betadine, shellfish, or x-ray dye?
no.
Okay, so do you need to use the restroom before we get started?
No, I think I'm okay.
Okay, I'm going to go ahead and raise your bed up to a comfortable working height. Can you tell me, ma'am, are you having any pain today?
I am a little bit.
Where's that pain located at?
Out here.
In your abdomen?
Mm-hmm.
Can you tell me when that pain started?
Yesterday.
Yesterday? Does it come and go? Is it constant? How would you describe that pain?
It's there all the time, but there are times where it gets a little more intense.
A little bit more intense?
It's like that all the time.
How would you describe that pain? Is it throbbing, stabbing?
When it gets intense, it's more throbbing.
More throbbing pain? Is there anything you do that makes that pain get better?
Yes, I take 4 Advil every 4 hours.
4 Advil every 4 hours, okay.
Mhm.
Anything you do makes it worse?
Well, no, not really.
No, not really, okay. And you are treating with Advil,
I am. I just have cramps.
okay.
I get this every month.
Okay. We'll definitely let your nurse know that on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you could feel, like a shark has ripped your arm off, how would you describe that pain?
Generally 4.
Generally 4. Well, before we get started any further, would you like me to go get with your nurse to get you something for that pain?
No, we're good.
Okay. Just want to make sure. Before I take your vital signs, can you tell me, have you had anything hot or cold to drink within the last 30 minutes?
No, because I have not had my coffee yet.
Okay. Well, after we take your vital signs, I'll definitely get with your nurse about that coffee.
Well, thank you.
So, have you had any trauma to your arms, any accidents, any breast surgeries, any chest surgeries?
No, I have been blessed. I have not.
Do you have any, do you take dialysis?
No, I do not.
All right, I'm looking for circulation. I'm looking for any signs of edema, which you do not have. And I noticed that your IV, which has been pulled out,
No.
is on the right side. So I would definitely take your blood pressure on the left. May I put that right there for just a moment, please? All right, I just need to make sure that your feet are uncrossed. Okay, I'm going to take your blood pressure up here. Normally I'd push this up, but it doesn't come up. When I put the blood pressure cuff on, I want to make sure that your hand is in the supination position. While I'm doing that as well, I'm going to put the pulse oximetry meter on the opposite hand of your blood pressure. And again, everything has been sanitized prior to use. Take your blood pressure, it's normal. Alright, what I'm going to do now is I'm going to listen to your apical pulse. Can I listen to your heart?
Of course you can.
Sanitize that. Don't do that. Clean, clean, clean. Neck clavicular line, 4th or 5th intercostal space. A little bit slightly to the left. I'm going to listen for 1 full minute. Okay, you have apical pulse of 69, and that beat is regular.
Why, thank you.
While I'm here, I'm probably also going to check to see if you have any kind of telemetry machine, which you do not. Alright, mind if I take your apical pulse? While I take your apical pulse, I'm actually going to watch for your respirations. I would note any use of accessory muscles. Feeling any shortness of breath?
No, I'm not.
Have you had any cough?
No, I don't.
Okay. So again, I would watch for 1 full minute. And your respirations are 17. So with the normal limits. No use of accessory muscles. No shortness of breath visible.
Good.
I'm going to take all this away. Next, I'm going to check all the lines. I know that you don't have a nasal cannula, but if you did, I would check the nares themselves and make sure that the prongs are facing in the downward position. Check the nares for any signs of irritation, skin breakdown, the cheeks, behind the ears, and make sure that it was securely fastened under the neck, but not too much that would cause you any discomfort. Do you have any pain at your IV site?
No, I do not.
No, you don't? I noticed that.
Well, I mean, I accidentally pulled it out 2 seconds ago, but it's doing okay now.
Well, we already fixed that, so we're good to go. But I do notice it is a 20 gauge, based on the color that it is at the hospital. The dressing is dry, clean, and intact. No warmth, no pain, no sign of drainage, no sign of infiltration. I do look at the IV tubing as I go around. As best as thing will stay in. Make sure there's no kinks, no air bubbles, that it's not caught up underneath you, that it's not anywhere that it shouldn't be. I would check this. If it's locked, you have a saline lock. If it's open, you have IV fluid flowing. Check the meter rate based on the doctor's orders. I do see you have D5W, about 600 milliliters left to infuse. It is cleared, and the clarity is good. The expiration is good. I would check to see if it's been hanging for more than 24 hours. If it is, I would notify the nurse. And the drip chamber is half full. Again, I would also check up here for your oxygen. See if it is the liters that the doctor orders, the liters per minute. You don't have a Foley, but if you did, I would check to make sure it is snugly attached in there. I'm also assessing your skin, your peritoneal area. Make sure the Foley is securely attached to the thigh. There's no kinks, no clamps. Follow it down, make sure it is attached to the bed frame and not the rail itself. No dependent looping. I will check the color and clarity of the urine in the tube and see how much is in the back.
But I can pee by myself, so.
Okay. Well, if you need any help getting up, please let me know. Alright, do you mind if I do a quick neuro assessment and check your eyes?
No, please do.
Okay. I'm going to flash this light in your eyes. If you'll look at my nose, please. Uh-oh.
No,
Okay.
okay.
Direct, indirect, direct. Also checking the size of your pupils, which is about a 3. Could you pull your mask down for me, please, so I can look at your face? I do see the face is symmetrical and even. Can you smile for me, please? Can you stick your tongue out? Will you open your mouth for me? See, the mucous membranes are pink and intact. The face is symmetrical. Any difficulty swallowing? No difficulty swallowing or speaking. Can I get you to squeeze my fingers as hard as you can with your hands, please?
Absolutely.
Very good, thank you. Now, if you would, will you push up on my hands like you're pushing them out of the bed? Thank you. Again, will you push my hands down as hard as you can? Thank you very much. While I'm here, I'm also going to check your pulses. Very good. Can you wiggle your fingers for me? Any pain, numbness, tingling?
No.
In your hands?
Well, I mean, just other than what I told you about.
Yes, ma'am, your abdomen. Okay, I'm also looking around, making sure the skin is good. I'd normally pull the blanket down and look at the legs. Excuse me. Will you push up on my hands? Thank you. Will you push down? Thank you very much. Looking at the feet, making sure they're good.
I
Heels
need a pedicure.
Don't we all? Heels are clean, dry, and intact. Feel good pedal pulses in both feet. Can you move your toes for me? Can you push up on my hand? Can you push down? Thank you very much. So now I'm going to take my gloves off, wash my hands, and apply a fresh set of gloves to my hands. Tripping on my shoes. I apologize.
That's okay.
All right, do you mind if I take a listen to your lungs?
No, go for it.
Okay. You already said you don't have any cough. So I would normally put this under the gown along with the apical pulse, but for this, we'll have it on the gown. Deep breath in and out. 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 Okay, what I would do is ask her if she can sit up. If she can't sit up, I would have her roll over on her side. While I do that, I'm also looking at her skin on her back and her behind, her buttocks. But I would also...
good you're not, because I'm not having my buttocks be on video.
No, ma'am. I would also listen to the 8 quadrants in her back for her lung sounds. Lungs do sound clear. No signs of crackles or striders or rails. Next thing I would do is I would expose her abdomen to listen to her abdominal sounds. First thing I would do is inspect, making sure the abdomen is good. Since there is pain, I will be gentle. If there's any discomfort, please let me know.
Well, thank you.
Just going to listen again. I would sanitize, warm up. You have to listen for 5 minutes total before you can say bowel sounds are absent in each quadrant. All right, I'm going to gently press. If it is painful, please let me know.
Okay.
Any tenderness or pain?
No, that's okay.
How about here?
No, I mean, other than that little dull ache I have, but yeah.
Okay. So right upper quadrant. A dullness, pain? Any tenderness or pain here?
No.
Okay. Can you tell me when your last bowel movement was?
Oh, maybe 2 days ago.
2 days ago. I'll definitely let your nurse know. Can you tell me what the color, consistency, and amount was?
Oh, everything was normal. That's normal for me.
Everything is normal, and that's a normal cycle for you?
Mm-hmm.
Okay. When's the last time you passed gas?
Probably last night.
Last night? Okay. So I've looked at your skin. I'm also going to check your skin turgor. Not for anything. Checked your skin turgor. Your skin is good. So I'm going to lower the bed. Is there anything else I can do for you before I go today?
No, I think I'm good.
Okay. I'm also going to reassess the room for any clutter or anything that could cause you to fall. Make sure the bed is in the lowest position. The front side rails are up. I'm going to also put all your belongings within reach, including the call bell. This is the call bell. If you need anything before I come back, please press the button.
Okay.
Again, I'll be back every hour to check on you to make sure you're doing okay. Is there anything else I can get you before I leave?
No, I think I'm good.
Okay, thank you. So I'm going to sanitize all my equipment again prior to use again. Take all my items out of the room. Take my gloves off. Wash my hands. Well, thank you very much, ma'am, for letting me participate in your care today. Is there anything else I can do for you before I leave?
I don't think so.
Okay, thank you again very much. Would you like your door open or closed when I leave?
Open is fine.
Open is fine. Thank you.